Thanks so much for having us today. My name is Michaela Kenmore Watson. I'm a health promoter in the Health Promotion and Vaccine Preventive Diseases Division.
And I'm Jackie Belletti. I am the Executive Director of Sudbury District Restorative Justice, and some of you may know me from my 30 years in education, and maybe some of you actually had it at Vice Principal's table. So what we are here today for is to speak to you about the Icelandic prevention model. And we're really excited to present to you because this is an upstream prevention model, and it's a substance use framework, prevention framework, and it's something that the community has just embarked on. It's a proven model to create healthier environments for youth, and it's led by communities to increase resiliency and well-being and to reduce substance use amongst youth.
As we present today, we want to acknowledge that while other local health units and other communities hold valuable foundational role in this work, we're just one of the many community partners, like Dr. Gucci mentioned, to support this model in our region. So our internal team is part of the Health Promotion and Vaccine Preventable Diseases Division under the Director and Chief Nursing Officer, Steve Gilpin.
So why start now? So why exactly do we start this journey to bring the Icelandic prevention model to our region? So right now we have all the pieces that we need to make this project a success. So the first piece is demonstrated need. And this model provides solutions to many of the problems facing our community today. Substance use rates continue to rise, especially amongst youth. Excessive alcohol use is concerning, as is the mortality rate from toxic drugs. The second piece is community readiness. Parents, families, and schools have expressed concerns of the health of our local youth. And the last piece is organizational capacity. Community organizations have heard the calls for action and have begun working to implement the model. Chicago McQuay Health Center and Sudbury District Restorative Justice are co-leading the local implementation of the model. And I'm going to go off script. We are deeply grateful for the backbone support that public health is providing to guide us through the implementation of this model.
So substance use is viewed on a spectrum from no use to substance use disorder. People use substances for different reasons and in varying degrees. Some people experience harms while some experience no harms. The influences for substance use are family and genetic history, peer and family dynamics, early life experiences like trauma and adverse childhood experiences, as well as social determinants of health like housing, stability, and income. What we know is that starting substances younger raises the risk for long-term. We also know that there's no single cause of substance use. It's a complex issue and it requires upstream, multi-layered approaches that focus on prevention and healthier communities for youth.
So in terms of upstream prevention, I'm going to get Michaela to explain this model that typically I think you have heard before.
Mm-hmm. So I mentioned that we need to change the society around you, and we need to consider the environments that shape them. Our aim with this project is creating environments that support them to make using substances the least likely option. And so you're probably familiar with this image on the screen. It's a boat parable. The idea is that we want to remove the logs in the water to prevent harms for youth. So introducing upstream interventions can try to eliminate some of those hazards. Moving upstream requires a shift in the way that we think about substance use. We can do this through upstream prevention. We want to create and promote protective and healthy environments, reducing risk factors and bolstering protective factors. The way that we do this, we need to think about long-term shifts and commit to seeing changes over the next 5 to 10 years. Through upstream prevention, we know that we can reduce costs in healthcare, law enforcement, and social services in our area.
So as this slide shows, you can see the Icelandic prevention model and that it is being implemented not just in the Sudbury area districts. In the late 90s, Iceland was facing the highest rates of adolescent substance use in the European Union. And due to rising concerns, they developed and implemented the Icelandic prevention model. Over the past 20 years, Iceland is now the lowest rates of substance use and abuse in Europe. So due to the successes of this model, and it is now being adapted to in over 30 countries and endorsed by the Public Health Agency of Canada. As of April 2025, a total of 10 Ontario communities have signed on with Planet Youth. And that includes, as you can see in the graphic, Thunder Bay, Timmins, Temiskaming. We've also been aware now North Bay, Lanark County, and Sudbury and Espanola. So the slide demonstrates the opportunity for us to adapt to a successful approach and make positive changes for the well-being of youth in our area and lean into our other partners across the province for assistance in rolling out this model. On this slide, you're going to see how the model focuses on 4 domains that shape youth outcomes. You can see the influence of family, of peer groups, of school, and of leisure time. And these environments play a critical role in shaping the risk and protective factors for youth. Importantly, the most effective prevention strategies often have little to do with substance use directly. Research shows that creating supportive, healthy environments is the most sustainable and cost-effective way to promote youth well-being.
This model's core elements directly align with health promotion practice by emphasizing community and youth engagement, evidence, and translating research into practice. The model grounds all its strategies in current aligned data to understand needs, measure impacts, and guide effective intervention. We'll be centering youth and community voices and will co-develop solutions that address social conditions, promoting relevance and long-term change. The model bridges gaps between research, policy, and practice, fostering ongoing dialogue. This ensures each informs and strengthens the others.
So this sort of project needs a village to make it a reality. And again, directing you to the graphic on the screen, leading the work is Chicago Quay Health Center and Sudbury District Restorative Justice. The steering committee supports the co-leads, and together they provide the direction of the project. So we're moving from the middle of the graphic out. The Prevention Coalition adapts the project to our local context and community needs. And the coalition includes many community partners such as schools, researchers, social and community services, and municipalities. And they are the drivers to making this project a reality for our community. A dedicated team from Planet Youth helps us through the implementation process, and Public Health and Sudbury Districts provides us with the backbone support in day-to-day project management and responsibilities. We work with everyone involved to ensure that partners have what they need so that the project can be successful.
So here's how it works. It's a 10-step cyclical framework. Steps 1 to 3 focus on building a foundation for readiness and engagement. Steps 4 to 9 focus on data-informed decision-making to reshape the social environment around youth. And step 10 evaluates the success of this first round. We're currently at step 3, working towards data collection, planning, and community engagement. Together with our partners, we've secured $236,000 to contract Planet Youth over the next 3 years. We've also leveraged $723,000 from Public Health Agency of Canada Youth Substance Use Prevention Program. And this will provide us with the necessary funds to implement steps 4 to 10 of this project.
So our next steps. The Prevention Coalition will meet in December, and we will begin mapping our community assets and providing feedback on survey questions. We will launch this project to the community in February 26 to build awareness and generate excitement. Before data collection in March of 26, we will engage youth and their families to ensure that they understand what's required of them. And lastly, we will continue to recruit community champions for our efforts with Planet Youth. And we'd like to begin by asking you here for your support and to spread the word about what Planet Youth can do for our communities. And that brings us to the end of our slides. And so thank you. Thanks for taking the time to hear our updates today. Thank you to Dr. Hirji for inviting us here to share with you. And we're open for questions or answers, Mr. Chair.
Thank you, Michaela. Thank you, Jackie, for the presentation. Questions for Mike and then Bob, anyone online? Go ahead, Mike.
And thank you through Mr. Chair. I really appreciate the work you're doing in this space and coming to present to us today. Very informative. We just can't move fast enough. And I say that sincerely. I'm watching the wreckage being left behind with the addictions in our community and I work downtown and we just can't move fast enough. So what does the timeline look like going from steps 4 to 10? First question. Second one, let's do that one first. So I don't. Okay. Yeah. Okay. Sure. We're focused on community questions.
Yeah. So first, like I showed on the slide, step 4 is about data collection. So in order to do something about this, we need to hear what youth are experiencing, and that will inform what we can do. There are lots of great programs and supports already in place, and we're hoping to leverage existing supports for youth. Like I mentioned, this is a long-term commitment. It will take time in order to see the changes that we can make. I understand. I also live close to downtown and see that there are a lot of harms happening, and we're really hopeful that this will make lasting long-term changes.
Thank you.
I have 3 of them.
Okay, go ahead. Yes.
So I just want to correct, I focus on the downtown, but it's not a downtown issue. Youth being impacted by this are throughout our community and throughout the communities outside of Sudbury, all those within the reach of public health. We just see a concentration of the outcome, if you will, closer to the downtown. With respect to the roles of schools, how amenable is the school system in participating in this, and have we had engagement to see what that's like? Because of course, that's one common area where youth congregate for about 10 months a year.
Yeah, go ahead.
Okay, great question. And 30 years background in education. And yes, we need schools on board because they are our gateway to students and parents. And so I'm very pleased to share that we have memorandums of agreement, all 4 school boards. And those school boards are all throughout our district. Rainbow Schools, Sudbury District, Sudbury Catholic, and the French Catholic and French Public. And so we have a great working relationship established. We've met twice. And we're really looking forward to working with them. The directors of education are very excited about this. In fact, the words that they use, we're all in.
Yeah, my last question, so thank you for that insight. And outside of schools, we do have vulnerable communities, which again, are not alone. This is a systemic-wide issue, but we see a higher concentration of youth in vulnerable communities present with opportunities to take on illicit drugs or alcohol. And this may be part of the data gathering. We don't have any answers yet, but do we know what that could look like as far as the outreach and the engagement of youth in our most vulnerable communities?
Mr. Chair, we're going to tag team this one. Okay. So in terms of the outlying communities, absolutely. There are unique situations within the entire district. And those situations are where we begin to lean into our community partners that we are reaching out to in terms of prevention coalitions. And our steering committee does have representation. So, for example, Ontario Health and the Provincial Services Board, Espanola, that is in Espanola, but they are also part of our steering committee. And so we believe that we have representation on our steering committee and our reach out to our prevention coalition, that we are going to have those voices at the table, recognizing that our district is very large. And also, I'm speaking to the choir. And the other piece also is that we have a deep commitment to Indigenous communities, teachings and learnings there as well as bilinguals, so that in French communities as well. So we have challenges ahead of us, but we do believe that we've got the structure and the supports in place to carry through and follow through.
Thinking about your comment about the downtown core and seeing youth there who are particularly having a challenging time. This model is particularly exciting because it will address and support all youth, not just those who are at particular risk. So we're trying to level up everyone in order to provide support to all. So we will be surveying and gathering data from specific schools, but that's not to say that only supports will happen within schools. It is a community initiative, and we're really eager to see the changes over the next 5 to 10 years.
I really like how you said that in terms of all youth, reaching all youth through it, and also the parents. And so what we're looking at is increasing protective factors, reducing risk.
Thank you. Thank you, sir.
Thanks, Mike, for the great questions. Bob, and then Natalie Labbe has her hand up, and then Natalie Tessier has it. Go ahead, Bob.
So thank you very much for pursuing this really important work. I've often seen in past agenda packages reference to the Iceland model, and I've been interested to know more about it, so this satisfies that. So I'm curious about step number 10, the evaluation. So how are you going to do that? What does success look like? How are you going to track the progress of this issue?
Mr. Chair.
Go ahead.
We've partnered with HSNRI, the Research Institute, and we have 2 researchers and evaluators who are on board to support this project. So the evaluation will look like evaluating not just the services available to youth, but also how this model is working for us locally. We have these 10 steps that are provided to us, and we'll get support from Planet Youth, but it is locally led and it will be different in every community. We haven't got there yet, but we're really excited to see what evaluation will look like and indicators for success.
So along the way, do you envision some kind of performance metric or something like that? Just
Absolutely, and we also like the survey that happens. It's rooted from Planet Youth, and they do a lot of the data collection and cleaning of the data, and then giving us the reports. And our local research, like Kayla had mentioned, they're very excited about joining us and being a part of this. So it's great to have their enthusiasm and their commitment.
thank you.
That answer your question.
Yeah, thank you very much.
So we got Natalie Labbe online, and then Natalie Tessier in person.
Thanks.
Go ahead,
Mr.
Natalie.
White. I actually had put my hand down because Director Perrant asked my question about the school involvement and buy-in, so that was really great. But I will just add the color wheel of all the partnerships was really telling of how far advanced we are compared to other communities with the amount of resources that we have in our city at our disposal to offer their insight and their support to getting this program successful. So it was really good to see that color wheel and just identify those partners specifically, because each one of them has a niche group of youth that they work with for different reasons. And I think that it's important to come at this in different reasons, because not all youth that are choosing to engage in alcohol or drug use are troubled youth necessarily, right? So it's nice to see a cross section of supports that are available to us. And you guys have Sherry Moroso, who is on a secondment to help lead this project with you guys. She's a phenomenal resource as well. She's been involved with the city in so many different capacities in her career, and I've got all the confidence in the world that she'll be able to be a definite asset in helping you guys with this project. And appreciate that you had some people coming from the Icelandic model to come and present to our youth advisory panel as well back in September. I think it's important to get their buy-in as we're in an incubator kind of state with our panel right now. I think the youth are just starting to learn a little bit more of all the different types of services we have in the community and what their roles can be in the education systems to engage youth. And I just appreciate that you guys made time to make that presentation. So thank you.
Thank you, Natalie. Natalie Testa, go ahead.
Thank you, Mr. Chair. Thank you for the presentation. I represent the community of Chapel. And unfortunately, the territory covered by public health submarine districts does not necessarily coincide with the territories covered by school boards. I'm a retired principal and my school board doesn't figure in a list, but I'm recently retired and I know that my school would benefit from this initiative. Are there plans to leverage, for example, Algoma and Huron District?
Go ahead.
We've been made aware that the Algoma District has made application to PHAC for funding for them to start an Icelandic prevention model within that district. Success or not, we're not aware of.
Okay,
Well, my commitment to you is you will have my email address.
Okay.
Right? And, I'm absolutely available to, update you on the progress and what we are doing within the Sudbury District. That, with your leadership, if you wish to, do some work within your community, I'd absolutely be there at your elbow to assist.
okay, thank you.
Okay.
I just have two questions. So when I was looking at the wheel, the wheel's not there now, but I don't see, how does, for involvement, what about GSPS? Yes.
So GSPS is a partner with us, and as you look through the wheel, like quite a few different domains, right? The educational domain, social services domain, medical, and we have justice at the table as well.
Okay.
And GSPS, the deputy Natalie Hills has been engaged with us. And so, yes, that is an answer that there is involvement with GSPS.
And my other question is related, so you want other champions. So the board, what other champions are you looking for? Or could you speak to that?
Yes, well, myself and Caleb both can, so that the Prevention Coalition is a wide sweep invite in order to bring everybody to the table. We may be missing people. And so please make us aware of that. And that doesn't mean that if we've missed in the first Prevention Coalition meeting, that it's closed. It's not. It's always open to, the community-wide participation. Did I answer that question?
Yeah, no, that's fair. It's just more of you're looking for
Okay.
champions for
Certainly.
us to help.
And,
What
and,
champions are you?
and we're gonna do presentations, so that's what you're going, right? Yeah, okay.
Yeah, we're in the new year hoping to engage schools, specific schools, and getting teacher champions, student champions. We need everyone at the table to make this project a reality if we want to see community implications. So that's where our efforts are going, but surely there can be other important community members who can champion and speak of this project and ensure that it's widespread.
And in order to champion it, you need the education on what it is. And so that's our willingness as well. We've already had requests from the directors of education to come in and speak with the boards. We've also had the thoughts of the parent council presentations. And we are also willing within the district, with the district services board, to be able to go to town council meetings and do presentations as well. So, as leaders, to be able to provide that education piece in terms of this is what it is, and this is the opportunities presented, and what we need from community members. I think it would be.
So when you're at that stage, I welcome participation to council, to mayor and council, because I think it'd be very, very beneficial. And I like the idea of not just the schools, but getting the youth involved, because if they feel that they're involved and empowers them to want to talk to their peers, and yeah.
That's right. Well, through you, to answer that, we've also already been making presentations to key youth councils for recruitment, because at the core of this project is nothing without us, right? Nothing about us without us.
Absolutely.
And so we're upfront with that, and the youth are going to inform the direction of where we go.
Thank you. Thank you for those answers. Thank you for the presentation. Is there any directors that haven't spoken that want to ask a question or have a comment? Hearing and seeing none. Again, thank you both, and we look forward to regular updates, and we'll connect to make sure that you're on the radar for the new year for the council.
Absolutely. Thank you.